want to say this before we get into Dust and I a little discussion. I think Dust coined it. We were talking before we started. Like it's a discussion, and you know, I've been told an awful lot that talking about the coronavirus is probably not the smartest thing to do. And walking into this, I was pretty nervous to do it. And then me and Dust started talking. That's exactly what it was. It's a discussion. It was something for in my brain 20 years down the road. If my children ask, what was times like? Here would be a glimpse into something, a glimpse into the day of what we're going through currently, specifically in Lloydminster. But I mean, you can extrapolate it to the rest of the world. But I want to leave you with this before you listen to it. Dustin and I aren't doctors. We're not scientists. We're just two citizens talking about what's going on and some of the research we've done. Linus Pauling, Nobel Prize winner in chemistry in 1954 and a Nobel Peace Prize in 1962, said, "When a scientist with reputation and dignity tells you something, listen respectfully, but don't believe him until you look into it for yourself." And I got one other quote. It says, "Please do your own research. The information I share is only a catalyst to expanding one's confined consciousness. I have no desire for anyone to blindly believe or agree with what I share. I seek the truth for yourself and put your own puzzle together that has been presented to you." And that's where I'm going to leave it. We're going to go into this, and I just want to, at the end of the day, it's just us searching for our own truth and listening to different people that I trust, and looking at what's going on in the state of the world, and so it's just a conversation that my brother and I had last night, or I guess April 1st.
The way I look at it is it's a discussion.
It's a discussion, fair. But if it never comes to light and my kids find it 25 years from now, I want them to understand what this time is like
Yes.
right
Yes.
now. And
Yes.
I was sitting talking with a guy today, and as scary as the coronavirus is, Dust, right now, probably just as scary as where oil is at and where our economy's at and where everything
Yes.
else is at, right? Like
Yes.
I'm trying to see 3 months from now, 5 months from now, and it's really tough because I see in like a week it's gonna get worse, another week it's gonna get worse, and then probably a couple weeks after that it could get worse. And you're starting to see the biggest oil companies turn down production, slow things down, do things I never thought I would see in my, I don't know.
Teck Resources today, a company that while they were trying to get that new mine approved,
Yeah.
they already had a mine running. They shut it in today.
Where's that?
Up in Fort Mac. And then there was some companies down in the States already that have declared bankruptcy.
Yeah, I saw that. Whiting or
Yep.
Whiteling or whatever.
Yep.
Declared bankruptcy. Well, you could probably explain the trend of the fracking, how many wells they have to keep drilling in order to keep it going up. But I was reading an article today where essentially it's gonna drop, like their oil production's decline because they're stopping producing, building, or drilling wells.
Like a couple things happen. You've got lots of wells in Canada and in the States that are, stripper low producers. Those ones will get shut in and they'll never get restarted. Essentially, like no one's going to restart them, and there's going to be a ton of bankruptcies. Like when you're talking about down in the States, they're talking as high as like 60 to 70% of the companies in the shale business going bankrupt. And then you look around Canada, like small businesses in general, like there's going to be a ton of companies going bankrupt over the next little bit. Everything's happening at once. You talk about not being able to see down the road. The reason time lengthening out or everything seems to be taking so long is because everything is moving so quickly. There's so many changes so quick that time seems really slow because of it. And looking towards the future, there's no way to plan for the future. Like, what does 2 weeks look like from now?
I don't know. I hope I have a job.
2 months from now? When do we start relaxing things with coronavirus? No one knows. No one has any idea what that looks like.
Well, and the scary thing is I already read an article, and I'd already read an article that, and I don't know, maybe ignorance is bliss. Maybe a guy should just stop reading, put his head in the sand, and not, like I read an article
Ignorance is
today.
bliss, yeah.
I read an
Cypher,
article.
hey, easy,
That's right.
buddy.
Yeah. I read an article today that said they're already predicting in the fall for a second wave of it to come. And I'd already read articles on 1918 and 1957 and that it came and went in waves, right? You'd have peak and then a drop off, and then it'd come back around. And it lasted like 2 years essentially until they found a cure and got it massively dispersed, whatever. And when you think about that, you go, well, I think at some point they have to figure a way to put us all back to work. Otherwise, you might as well just lock us up for a year and, right? Give us enough to put a little food in our belly and shelter over our roof. And
okay, so if we're going to talk about this, let's go back to the start, because even though I know most people know this, I still have conversations with people about this is just another flu. You and I have talked about this. It's just another flu. They're overhyping it. It's media, blah, 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 blah. Right?
Yeah, can you hear me better now?
Yeah, I can.
No, I guess I should maybe talk into the mic, eh?
Can you hear me?
I can hear you fine. My mic was sitting over there. Also, I'm like, I have no idea what I'm talking into, but.
So when it comes down to this, the exponential growth, which some people just can't seem to grasp, but essentially when you're doubling the amount of people that have it every second or third day, at the start, it starts off slow, but as it grows, and you can see it in a place like New York now, like they're getting tens of thousands of cases every day now, new cases.
Well, I don't know is it tens of thousands?
The New York State, not New York City. They were at 50 or 60,000 last time.
As we're talking on April 1st, no April Fool's joke here. It is 935,000 worldwide cases, 47,000 deaths, 194,000 recovered, and the United States leading the way with 215,000 cases now.
Yeah, that's because China's not reporting their numbers properly.
Fair. New York is at 83,000, the state, and it doesn't show how many new cases they had today. Yeah. Although we're getting late enough.
They're adding like 20%, just under 20% today the last time I checked. So
yeah,
20% of 50,000 is 10,000 a day.
You know what this reminds me of? And you remember the math problem in school where they said, would you like, and I don't quote me on the numbers, would you like $1,000 right now, or is it a penny a day or $1 a day and double it every day for 30 days?
That's actually a fable that goes back to an old fable about an emperor and someone playing chess. And the emperor wants something from the guy, and the guy says, well, if I beat you, I'll take 1 grain of rice on the first square and then double it for every square on the board. And the emperor goes, that's nothing, essentially. But the guy won, and he essentially had every grain of rice in the whole country. And he fed all the poor people, is the fable. But
fable. There you go. Well, isn't that what this reminds you of?
Yes.
I mean,
and that's why people have troubles grasping is the exponential growth of it. Now, it's exponential growth combined with the death rate, which is anywhere from, 0.8 to maybe 3-4%.
Well, here, let's bring up Canada. Canada right now, April 1st, 9,731 cases total. Yeah. And in Alberta, we're at, what is it, 900 now?
I thought it was 8 some, but.
Here, I'll bring that up too. Alberta. Because it was just listening to the lovely lady talk tonight.
when you're going through that, the first one,
Alberta's 871. And
yeah,
the reason why people struggle with it is because they go
because it's a
800.
small number.
It's a small number. That's
Absolutely.
exactly why they struggle with it. Heck,
Yes.
you go like, what's my probability of running into somebody at this point with it? Heck, I've sat in the coffee room and somebody's been like, well, do you know anybody with it? And I'm like, no, but I don't think that's the point. I don't think I'll ever want to know anybody with it.
Yeah. So that's the thing people don't get. And so Alberta is in a good spot because they jumped on it real quick and they shut down everything. They pulled schools early. The reason why New York's in trouble is they didn't. And to go from 5,000 to 50,000 took no time at all. And they're still going to grow for another week or two before they're going to start to see the number of new cases over, daily new cases start to drop a little bit. But there's two things with this. One is the death rate, and then the other is the hospitalization rate. And everyone's talking about this. You get too many people in the hospital at the same time, they can't take care of them, and you're screwed. Is New York there? That they got to be awfully close.
Well, that's why they're bringing in everything, right? That's why they brought in that ship to put in the harbor so
Yes.
that they could give them more beds. That's why, like, talking with Mel's, with Rachel, they're a nurse in Minnesota. They're converting hotels so that they can house more people that way. You heard today, I think it was today's news conference, they asked the doctor there if they're starting to do things like that in Edmonton, if they're going to
Yeah.
start, or in Alberta, I should say, right?
Yeah.
Start converting things ahead of time. And what they said is right now they have, oh man, it was a lot of beds, like 2,000 and some beds or something.
Yeah. Yeah. Well, and I've heard they've already talked to the U of A about the Butterdome and converting it. And essentially, one of the things that Italy started to do, that China did, was separate out your coronavirus patients from your regular hospital patients so that your regular hospital patients don't get it, essentially. Because when they're already weak in the hospital, if they get it, they pretty much die or have a greater risk of dying, essentially. So they're trying to keep the coronavirus patients separate from everybody else who's sick. The one thing I hear about from time to time, wow, quite a bit, is, well, we don't know how many people are sick. There's lots of people who are sick who aren't tested, and I get that. And they're like, well, it's not as dangerous as what everyone thinks. And I go, well, if you overwhelm the hospitals, and they go, well, we're not here. We only have 871 cases or whatever in Alberta.
Yeah.
I go, well, you better keep a close eye on a couple places. New York, which is already, freaking close. Florida's probably another one. Sweden's another one, where they didn't isolate they isolated way late. And watch how those play out before you decide whether this is dangerous or not.
Well, the thing they kept saying is that Alberta's increasing at 2% a day.
More than 2%.
Is it more than 2%?
Oh yeah. Are you talking about cases or?
No, you're right. It's 2% of people tested test positive for it, is what it is.
Oh, yeah, I got you.
Because they tested, I think, 4,000 and some people is what they said, and only 2% tested positive.
Yeah. The funny thing about it's obviously deadly enough, which is why, wow, all you got to do is look at Italy and Spain, and I would say within a week, New York, to go, crap, you got to get ahead of this thing. But the real, at this point, I look at it and go, cool, so everyone's isolating, which is good, to get ahead of it. But, shutting down your economy for a long period of time isn't a great option either, because that hurts everybody. And the government can't afford to keep paying people that aren't working, essentially.
Well, not for the rest of the time unless we...
Well, 2 years is not an option, right? So then you go, okay, well, what can you actually do? So social isolation is the first thing, because essentially you're slowing down the transmission because no one's around each other, essentially, right? The next thing, and it's becoming more and more apparent, I think, that masks are going to become a big thing. And essentially why that is, well, and there's countries that are doing it already. The masks slow down the transmission, but allow people to go out in public, essentially.
So you're a big pusher on masks. That's what you're saying. That masks are going to put us back to work. That's what you think?
I think so. Okay, well, let's talk about the problem in general. You've got probably 3 different ways where people can go back to work. One is a vaccine,
Which is a ways off.
ways off, probably beginning of next year. So you can shut down your entire economy until then, but your entire economy shut down until you get the vaccine. It's going to take a while to test, and you don't want to just start injecting it in people, right? So vaccines one. One is social isolation, which we're doing right now to slow down the spread, which is fine, but at a certain point, everybody wants to work and no one wants to be cooped up in their house for the rest of the time. The next one is treatment, which they are making progress on that, and there's some promising, well, it looks like there's some possible treatments that are actually readily available that may help things. Hydrochloronique is one of them, and I can't even pronounce them. Azithromycin, I can't even pronounce it. And then zinc sulfate and vitamin C, I've heard, or some combination of those ones. They're going to keep working on that, and if they could ever get that, if it proves out that can reduce the amount of hospitalizations for one, because you can treat at home with those, and the lower the amount of people dying, then all of a sudden you don't have to worry about overwhelming your hospitals. If that's the case, then you can start letting people out more readily because you've got a treatment that reduces the amount of people in the hospital and dying. So that's a possibility of people going back to work. And then masks is kind of the next one, because, okay, so you can either keep people at home, which no one wants long term. If you can let people out but slow down how quickly it's spreading, and the only way, well, hand washing is one for sure, which everyone's kind of doing, and social distance. So the only one that can really be implemented right away is masks. And so,
well, and what they were saying about masks too is it doesn't have to be one of these medical masks. It can be literally a piece of cloth.
Well, here's the thing: is you don't want medical masks because you want those for your healthcare workers because they're in the most dangerous situation. The cloth masks you can make at home are really cheap and easy, and you want people to use those anyhow. It isn't a perfect solution. It's not like it's blocking everything, but if you can limit the distance the droplets in your breath or your cough or your sneeze are going, that's going to reduce the amount of people getting sick. And if you look at places that have already implemented that, their curves have essentially flattened. So if you want to talk about getting the economy going the quickest, essentially masks is the best option.
Wouldn't that be interesting to see walking around as masks everywhere?
I wore my first mask in public today.
Did you?
Yep.
How did that go?
I had an old guy quiz me about it. I had a good conversation.
And what did
he was wondering how I was able to breathe in it. I said, I can breathe just fine. He's like, oh, I don't know if I could wear it outside. And I look, when I'm out for a walk outside, I'm not concerned because if I'm outside, I'm less worried about, I can physically space. I can be away from people a little bit more. And I'm not as worried about stuff hanging around in the air because there's breezes and it's open air, right? Whereas in a building, that's where I get concerned about. And I said, quite honestly, I think masks are, everyone's going to be wearing them within a couple of weeks to a month. And his wife turns to me and goes, I think you're right. They were an older couple. They must have been in their 70s probably.
Have you read things saying that it can go farther than 6 feet then?
For coughing and sneezing, yeah, they think it can.
It's a scary thought.
Yeah. Well, the thing about a mask is, I don't think it's so much about preventing. If one person wore it, it's not so much about preventing people infecting you. It actually prevents you from infecting others, is how you should look at it. Now you could say, well, I'm not sick right now, but this disease, the problem with it is, or the problem with the virus is, you have a period of time where you're not showing any symptoms, but you actually have it and you can spread it. So if everyone wears masks, you're keeping your own, um, you're keeping everything to yourself, essentially. So if everyone wears them, then it slows down the spread. It's not about protecting yourself. It is about protecting yourself some, but at the same time, it's protecting everybody else from you. It's really a courtesy thing, is the way I
Yeah.
look at it.
So if you do have it, you're not spreading it.
That's right.
Well, I can see how, like, as time progresses here, you know, everybody, let's take mom for example. And she's getting to where she hasn't seen the kids now in like 10 days. So now she's starting to be like, you know, you could bring the kids out. You could leave them here for a few days. And Mel and I are going, well, that's the whole point of social distancing, right? Is that, yeah, it sucks, but you and dad are probably two of the top people in our family that are the most at risk, right?
Yeah.
Like, and it's not that I don't think you got decent health or good health. Heck, for 60, both turning 64 here. It's
Yeah.
the fact of the matter is you're in your 60s and this thing looks like it doesn't do well with people over 60.
Yep. Pretty much.
So I can see, you know, I look at it and I go, if mom's saying it, there's other people saying it, right? Like,
Yeah.
there's other people, you know, we walked by, we went for a walk last night. We walked by Harley and Steph's, and they live just down the road, right? People, if they do listen to this, that's um, second oldest or next oldest brother and his wife, and they got kids that are the same age as Shay and Mila, right? And Shay lost his absolute shit when he couldn't go inside, right? Like, we're waving at him through the window and they come out and said hi, but Shay doesn't understand yet. Well, I mean, he kind of does, but he's 3, almost 4. Like, he doesn't get what being sick means, right? And I can
Yeah.
see how that I get old here. And I mean, yes, it's a minor. We're not going to war. And I've heard all the things about, like, you know, we're asked to sit on a couch, and it's like, yeah, absolutely. But as time goes on, that adage is going to get old too, because I mean, 2 weeks, okay. 3 weeks, all right. 4 weeks, it's getting a bit long in the tooth. And by 5 weeks, you're going like, maybe you don't know anybody yet.
Yeah.
Or maybe you haven't worked in 3 weeks, or maybe whatever. Maybe you can't see the end of the tunnel now, and you're going, man, I got to get out of this place. Let's go have a beer with somebody. It ain't going to kill us.
Well, the thing is, that Becky and I actually started having conversation about this week was, what point do you actually start to see people again? And there's a private versus public conversation, because public is one thing, but do you start seeing people, in your immediate family? At what point do you start doing that? Because you can't, like, 6 months, like, if someone told you for 6 months you couldn't do it, would you go, ah?
That sucks, but okay. Like, we can suck it up for 6 months.
The problem is, though, is you go, okay, but there's no end date, and that's the problem. And you have
Yeah.
no idea, and they can't give you an end date because there is no end date. And so it's yeah, there's no other way to put it than it's tough.
Well, I know I talk about it lots, like using the phone and like FaceTime and everything is like wonderful. I mean, can you imagine going through this and not having this ability to talk to each other?
Yeah.
That'd be tough, but I mean, yeah, like, I don't know. It's just at the beginning, and I'm starting to be able to, like, I'm going on almost double digits of people I know that are laid off now.
Yeah.
And we're what, like 3 weeks into this thing?
Feels like forever.
It feels like forever.
Yeah.
And, Trump said, I love Trump. Jeez. He says in his one press conference, I want the country back up and running by Easter. So everybody gets, oh yeah, here we go, Easter. And now it's the end of April. But now you're starting to hear murmurs of end of May.
Yeah.
And you're going, okay, so nobody has a bloody clue. And that's probably the biggest issue with all of this is, like Dr. Hinshaw does an absolutely fantastic job on that press conference every day. I think she is like, man, she could be premier any day in my eyes. Like, she just is so calm and cool, answers questions. I get it. She's a health
Yep.
professional, like,
Yep.
but she's just like rock steady when it comes to crisis mode, right? The only issue is they're just going day by day and updating as it goes because nobody can see where this goes other than we're trying to eliminate the spread to try and knock down keep it down so the hospitals can handle it. Everybody's starting to get that, I think, for the most part. I think, if you look 3 weeks ago, nobody got that. We got 5 cases. What the hell's a big deal, right?
Yep.
Then we got 12. Okay. Oh, we got 15. Whoop-de-fucking-do, right? Like, you could hear everybody talk about it, and now it's different, right? I'm not saying everybody's perfect because they aren't, but I would say, lots of people are starting to get it now. It's become a very common term for being at home or being quarantined or whatever else. But at the end of the day, we talked about it before. Nobody can figure out if this is, a month from now, 2 months from now. Hell, I'd hate to own a business in town right now. I mean, you're an oil company. That's an entirely different bag of fucking balls wax. But like, can you imagine owning,
A
XYZ
restaurant.
store? Yeah, downtown. At least a restaurant you can have not click and connect, skip the dishes,
Yeah.
right? At least you can at least get some business that way.
Yeah.
I was in talking to the boys at Factory Sports, and they got their storefront closed, right? You can still call them,
Yeah.
and if you want to get something that way, but like you can't physically go into their store and like look around and
Yeah.
right, like so now you got to sit there for a month, 2 months. Can you imagine all the stock that's just sitting there? Like, what do you do with that?
I don't know. Well, at what point? Well, and that's why I think masks are going to be a big part of the solution because, okay, so you're the government. Let's say your number of new cases keeps going up, but you've isolated, so it starts to come back down again. At what point do you start to relax things? Because as soon as you relax things, the
It's
numbers are
gonna
going to start.
it's gonna go up again.
Right, and so you're trying to balance. It's almost like a Goldilocks zone where you don't want no cases, but you don't want too many cases, and you don't want to make an error of letting it go too long before the cases get too high, because then you're kind of screwed. And that's why I think masks might be a decent solution where you can let everybody out again, but you still slow the spread.
So you're saying we should go into the mask building enterprise?
Well, I think it's coming no matter what. I don't see any other way around it. I hope to God the treatments they're working on right now are working as well as what the initial results showed.
Outlooks look like, yeah.
Because if they could ever get a treatment that is that effective that people can take it home when they find out they get it, then you can keep everybody out of the hospitals or a majority of the people out of the hospitals, and then you pretty much just let it run. Well, what you probably do is totally isolate your, 70 plus, 60 plus population, whatever you want to call it, and just let everybody else go. And it would travel through quick. You got treatments for it that is very effective. And maybe that's wishful thinking, but you could get away with it, essentially.
Yeah. It is.
The other one's the vaccine, but we're still talking about, 6 to 9 months out, probably 9 months at the earliest. And that's a long time to go.
Well, when you just think like, speaking of Lloyd specifically here, when I was driving out east, so, rolling down the road there and, you just look at the casino, brand new casino,
Yep.
locked up. I don't know if they're in better or worse case scenario than a lot of businesses in town, but I mean, 6 months from now, what the heck becomes of that place? right? Not to mention the tire shops, the restaurants, the bars, the everything.
Every,
And
everything.
that the crazy thing about it is, and this is what my brain has a hard time wrapping itself around, is you're not just talking about Lloyd. I, you know, once again, I've talked to a lot of guys about this. Is I'm a proud guy. Like I lose my job tomorrow, my pride's not going to get in the way of me going and finding work. And I'm talking like 2 months ago, hell, a year ago. If I lost my job, I would go be a fish fry guy if I had to. I'd be a cook. I'd be nothing against cooks. That's not what I was going for. But I'd be whatever. You give me the job, I'd probably do it to make ends meet. I'm not going to sit at home. I want to work and earn my paycheck. And the crazy thing about right now is like you lose your job, maybe there's somebody hiring, and dang sure there's people looking right now. But I mean, you can't go to BC and grab a job. You can't go to Saskatchewan and get a good job right now. You can't go halfway across the world and find a job right now. So
Yeah,
this is
I don't
everybody's
think there's jobs
economy,
out there. Yeah.
right? So we're talking about like 50 years from now, when we're looking back on this, the way I talk to the guests that come on that are older in that generation, the dirty 30s, World War II, the 80s crash, stuff like that. Heck, Man on the Moon, JFK.
Well, this is it.
This is it. This is one of
This
those
is it.
events.
Yes. The last one I think that was probably this big was probably 9/11.
Oh, absolutely. There's only one other event in my lifetime that sticks out as much as this, and it's definitely 9/11. The entire freaking world shuddered when that happened.
I think this one will be bigger. I'm sure it'll be bigger. That one was like your whole perception of the world changed in an instant, and it was visual. Whereas this one is this long, all-encompassing change.
And I just think of dominoes falling,
Yeah.
right? Me and you talked. I remember watching it when it was in China and we didn't have a case, or maybe we had one or two cases in Canada. It was very, very minor. Actually, I want to say it was when Toronto first got it, and we're like, ugh, this doesn't feel good. And I
Yeah.
remember watching it and just slowly, and it's just crazy because it's only, in the beginning, it's only like a case or two. But then those cases or two spread, and if they don't catch them, and you can just like when you listen to the Hinshaw and Jason Kenney talk, you can just sense they're trying to, okay, if you've been here, lock yourself in. If you've been here, lock yourself in. We got to lock everybody down who's been anywhere, otherwise this thing's going to get out of hand in a real hurry.
Yeah.
And but another domino falls, and then another domino falls, and then I mean it's the perfect storm really, because I mean the coronavirus. You got the oil warfare going on between Russia and the Saudis, but now with the coronavirus shutting down everybody's economy, nobody needs any oil anyways. The entire world's full of oil. Nobody
Yeah.
can work because they can't walk out because the government said your business ain't essential,
Yeah.
right? So nobody can open their doors even if they wanted to. You can't drive anywhere. I mean, you can, but if you have symptoms, a cough, anything, and you get caught, now you're $100,000 fine, right? So everybody can lock in their house, and I think we can all agree that is utmost importance. 100% behind the government. But now the economy, how do you dig yourself out of this? How do you even come close to digging yourself? How do we get back to even where we partially were? And we're not even into the worst of it yet.
I think, quite honestly, what I think is I think the rebound will be quick. I think it'll be quick, but what we're going to is not what we came from. I think there's huge changes coming with how the world runs, essentially.
Well, maybe. What are you thinking? What do you think's going to change?
Well, there's simple things like a lot more stuff is going to become hands free and those kind of things. Just to stop or slow the spread of stuff. So that's one thing for sure. Um, but you look at like this whole border, country border thing, conversation that's been going on for a long time. There'll be some big changes around that. I think if you look at something like the EU, I think it's totally going to fall apart coming out of this, essentially, because that was all built on open borders. And when this hit, countries soon realized we got to lock down our border, essentially, and there's no way around it. So I think there's some big changes coming that way. And then I think on the personal side, forcing people to stay home with their families, and this is going to seem so weird, but there's going to be some good things that come out of that, I think. It forced everyone to quit going a million miles a minute in all different directions and actually spend time with each other. And yeah, well, you already see in China that there's going to be a lot of divorces coming out of that. But I think it might wake people up to the fact of what is actually important in life, and maybe a reset. I wonder.
Have you enjoyed being at home with your family?
Well, it's had its moments. I would say this is that I've done a lot of things with my kids and my family as a whole that I've really enjoyed that we would have never done without this. There's been times where, man, I really need to get out of the house and I'm going to strangle someone. But on the whole, I think it's been really good.
I've probably said this to you before. This is probably since my children were born, so going back to Shay, so that is 4 years, the most time I've ever spent with my kids.
Yep.
Like, not even close. Not
Yep.
summer times. I mean, vacations, obviously, but even then, and it's pretty crazy to think because I'm still working, right? I'm still usually, down in Mel has been fantastic through all this. I'm stuck in, well, the spare bedroom, as you can see, and got a little office set up here. And from 7 till noon, the kids don't bother me. They may tap on the door every once in a while, but they know I'm not to come bug me because I got things to do. Or, today I was out to site, so I was gone all day. So that still happens. But on the whole, I was pretty busy at nights. Actually, I was really busy at nights.
You're probably busier than most people I know. But having said that, I look at, my family and how much stuff we had on the go. And, well, it's just my daughter's disappointed because she's not dancing and she loves dancing and all the rest of it. But, there's 2 to 3 days a week where I have the kids all day. And then we don't have any activities at night. None of us do. So we just spend a lot of time around each other. And we've started to play more with each other, I'd say. There's something about boredom and creativity that go together for sure. And play, I think, kind of combines with that, where instead of having all this structure all the time, you can't structure your whole bloody day. You just don't, and you won't with your kids, right? So because we're not going a million miles a minute with activities nonstop, all of a sudden we slow down enough to where we actually start interacting with each other instead of, just having structured things all the time.
Yeah. I've had a lot of fun with the kids. Well, I've had a lot of fun with the kids. I know my wife by now. I said on the last podcast I had that I'm sure Mel wants to kill me by now. So of course, what happens? my mother calls and says, I could really take the kids to, give you and Mel a break. And I'm going, what? What are you talking about? She's like, well, I listened to your last podcast. It sounds like you're, I'm like, no, I'm just kidding. Like,
Yeah.
geez, no, we're doing actually really, really well. Right.
Yeah.
Consider it. I mean, it's busy, but it's good busy too. I'm trying my darndest to have the patience to deal with kids who are cooped up as much as they've been cooped up. And Mel's been doing a ton with them, right? Like they pretty much have Bill Nye the Science Woman. Today I came home and they'd in like little muffin trays. They put in what do you put in a volcano?
Baking soda
Baking soda and vinegar, but then you put a little bit of dye on it,
yeah.
and they used like a little squeezer, like a little
eyedropper or something.
eyedropper kind of thing to put the vinegar in it. So then it'd bubble up different colors. Oh my God, kids just love that.
Yeah.
But every day I come home and she's got some new thing, and that's married to a teacher. She's just constantly ahead of the curve with new things for the kids to do. But it's been heck. We took a drive through Lloyd for those hearts in the windows. Everybody's been putting up the hearts. And we just cruised through. I'm sure people thought we were creeping the entire neighborhood, but we just cruised through and looked for and had the kids counting the hearts and everything. And that was a fun night. I'm not sitting here and saying I could do that every night, but that was a fun night. Kids enjoyed themselves. It's
you know what we did tonight? We made a family dance routine. Nora wanted to dance, and she turned on some music. I'm pretty sure she was choreographies for moves. And she's like, Dad, you should do this. And I'm like, sure, I'll go do that. And then pretty soon we're all in this dance routine. It's probably like, I don't know, a minute long or something, maybe. I don't know. It's this whole thing. And pretty soon I'm going, I could probably lift someone up here. And Nora goes, yeah, that'd be awesome. And I'm like,
have you seen the family of, I think it's 5 or 6, the 6, they got 4 kids, sing the song about being quarantined?
No.
It's all like six of them, mom, dad, 4 kids. The littlest one's got to be Shay's age, I would assume, maybe a touch older. And they sit there and sing for like a 3.5-minute video. And it's pretty funny.
Yeah.
Right. It's totally choreographed. I kind of laugh at how many times they must have had to have done that to get it right.
To get it right.
Yeah.
No, so we're talking about changes. I got to think there's going to be some things that come out of the education system that'll change because of this. And I'm sure there'll be some stuff coming out of the medical system too.
I tell you what, Dust, you talk about those two. How wouldn't businesses change right now?
Oh, yeah.
Think of this. Let's use downtown Edmonton corporate center, whatever it is. You each get your nice cubicle, whatever it is.
Yeah.
Right? You drive an hour to work, 40 minutes to work, half an hour to work. Heck, if we've been through Calgary, it's an hour to work. To go sit in a cubicle, to sit on the phone, type a little on the computer, talk with a few people. Maybe you got a meeting, maybe you don't.
Yeah.
80% of that can be done from home, minus the commute. They talk about getting rid of some emissions. Well, eliminate the commute. From a company standpoint, now you can downsize. You don't need this giant office building. All you need is, I'm not saying you don't need an office building. You probably do. But you don't need the giant one anymore. People work from home, and everybody always worries if people are working from home. Well, if they don't get their work done, can them and get somebody who does. Like the game doesn't change. People can slack just as much sitting in a cubicle as they can sitting at home. And let me tell you, if you got 3 screaming children like I do, you lock yourself in the room and you do work because
I'm working here.
Here's to hoping Keith Morrison responds back, because it'd be cool to have a Dateline, Mr. Dateline on.
Yeah. Something else that I wonder about too is with how the UN and the World Health Organization has handled everything, just trust in huge government bodies like that. And I guess having said that, I look at the Alberta and Saskatchewan governments. I thought they've done fantastic jobs, quite honestly, from start to finish.
think of the pressure though on
Oh, I know.
not to
It'd be
cry
huge.
wolf, right? Like, is
Oh,
it
it'd
that
be
bad?
immense.
Like, you'd have to show them so much data. There's only 5 cases. You got to think they're sitting in their shoes. To walk in, use Jason Kenney, for example, to walk in his office and say, listen, we need to. And he's gone, yeah, but there's no cases in Alberta yet, or there's only 3.
Yeah,
Yeah, but this is what it's going to do. You can just imagine the charts they've put up and like,
yeah,
listen, this is how bad it can get. And I
yeah.
mean, Alberta at that time at least had a couple countries to kind of look at. But imagine being uh, the
Oh, I know.
WHO and being the guy talking for it. It's like your thoughts on them at all, whatever. I mean, whoever you are, it don't much matter. At the end of the day, though, they're sitting there. If they don't say anything and it goes really bad, now they look terrible. If they say something too soon and they cure it right away, now they look terrible. Like it's
Yeah.
almost like a catch-22, isn't it?
Here's the thing, is that when you're in a government position like that, the thing you want to do, you never want to be remembered for underreacting and people dying, essentially. You got to take the safe line. And then if you get going down the safe line, and that's what Kenny and Mo have done in Alberta and Saskatchewan. Like actually, most of the provincial, the province premiers have done great jobs, quite honestly, I think, where they got on it quick, essentially. And the worst thing that can happen is you get on quick, nothing happens, and everyone's mad at you because nothing happened. But that's a much better position to be in than the opposite, where you don't do anything. And for example, like New York, the guy who runs that place is going to get crucified because he didn't shut anything down quick enough, and they had parents writing them asking them to shut down the schools because they were concerned. And now they've got over half the cases in the United States. Like you don't want to be that guy, right?
Yeah, well, you don't have to be, he wasn't the only one, that's the thing, right? Like
No, no, I know.
I think of the UK when we
Yes,
were shutting everything down, they were talking about herd
immunity,
immunity,
herd immunity. Yeah,
right? Just letting everybody go about their daily business,
yeah,
get infected, get sick, get better. The sooner you get
yeah.
better, the sooner everybody can infect you, carry on. And then, we had already shut absolutely pretty much everything down and they were just closing down bars.
Yeah.
But I mean, shoot, did you see the report today about the kids coming back from Mexico on spring break and like 27 of them getting COVID?
I missed that.
I'm like, huh. But I'll bring you back to Lloyd again. I'm across from the apartments, and every once in a while you'll see a group of youngins go
Yeah,
in, and you're like, I'm trying to put myself back in there. I don't know if you would have realized how serious the situation really is,
probably not.
right?
Another country to watch for is Sweden because they're not shutting anything down either. They still got schools going on and stuff, and they say, well, we're just going to physically, uh, keep physical distance, separating
And
in
they're
public.
currently at 49, 47 total cases and 239 total deaths.
Yeah. Because I follow some guys on Twitter and they're like, oh, we should be following Sweden's model. Everyone else is overreacting. I'm like, okay, you can say that about Sweden now, but give it 2 or 3 weeks and see where they're at. Because that's going to be the real test.
Yeah. I remember everybody talking about Russia. And you remember, like, Russia doesn't seem to have any cases. And now they've locked down Moscow and closed their borders. And, well, they're slowly climbing up the ranks of cases. They're at 2777,
Yeah.
right?
Well, and some of those countries like Russia, well, I'll tell you this. I trust the numbers from the Western countries a lot more than I do from China, Russia, anywhere in the Middle East. Just because, well, them changing or hiding their numbers is a greater possibility, is how I put it. Because I
Yeah.
think Iran's numbers are probably a lot lower than what they actually are.
Iran says it's got 47,000 cases and 3,000 dead.
Yeah.
Man, you look at the total debt, like Italy's got 13,000.
Yeah.
Yeah, I don't know.
I'm telling you, week or two, we're going to all have masks.
Well, maybe you're
Homemade
right.
mask.
I hear they canceled Wimbledon today to talk
Yes.
a little bit of sports.
You laugh about the mask, Sean, but if you knew that you could go in public a month or two sooner by wearing a mask, would you do it?
I'd wear a mask.
Absolutely. And that's how you sell it.
Honestly, I tell you
That's how
what,
you sell it. You go, you can get your business up and going if everyone wears masks, and everyone
I
will go,
I
okay.
tell you what, probably the biggest thing right now is I ride around with a bottle of hand sanitizer. Think about that.
Yeah,
It rides
yeah,
shotgun to me.
yeah,
And I'm almost OCD on it. When I get out of there, I'm gonna just squish, 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 wipe.
yeah,
Then I drive a little, and then you get out and do it, and then you're like, all right, well, put some more on, right? And then you touch
yeah.
your keys, and you're like, oh crap, should I put more on? And so if you told me that as long as I wore a mask, which I mean, this wouldn't be entirely true because you'd still have to worry about your hands and touching your face and whatever
Yeah,
else, as I've
yeah,
touched my face 8,000 times since we've been talking.
yeah.
But if you told me it eliminated the chance of getting anything or giving anything by like 70%, yeah, I'd be all over it. I'd be like, I'd feel confident in going outside again. Because right now, I tell you, if I'm around people, I'm a little bit gun shy.
Yeah. I think the stat for the cloth ones is like 60%.
You can't go wrong then, is what you're saying.
Yeah. Well, and I think they said 60%, and if you wash your hands 10 times a day or something like that, it goes up to like 90% or something.
Hmm. Well, I guess we'll see.
No, I put money on it, but I don't think you want to bet me. So
No, I don't really want to bet you.
no,
I
no.
want to see everybody. I want to see all businesses back open and kids
Yeah.
getting to play together, and that's what
Yes.
I want. That's what I want more than anything. Is I want my kids to have, Shay's birthday here in 6 days. Turns 4. He's been
Yeah.
talking about this birthday party since his third birthday party. Right? That's a full year, and he
Yeah.
knows that nobody can come, and it's
Yeah.
almost heartbreaking to listen to him talk about it because he goes, "How about Bubba?" Right? He goes, "Well, can Mason come?" Right? That's his cousin. And no, Mason can't come. Oh, he's sick. Well, we got to be careful. Okay, yeah, okay. How about Bubba? Bubba's his grandma in the States. And Mel goes, well, and he goes, she's sick too. And she goes, well, no, but I don't know if the planes would let her come. And he goes, the planes are sick too. And he starts losing his, right? And he's crying now. And I'm like, oh my God.
Yeah.
Right? So when this is all done, he's gonna have it's crazy to think he's gonna have the greatest like 6th birthday ever because we're just gonna
Yeah.
invite the whole town. We're gonna
Yeah.
get freaking elephants and magicians.
You know what I would give to have the kids playing and having a beer with someone while the kids are playing there?
Oh
Like,
man,
seems like the greatest thing now.
I I read a tweet today that said, "I'll never." What was it? I'll never forget like how fucking important beers with friends are. Basically,
Yeah.
is what it said, right? And I'm
Yeah.
like, so true, like so bloody true. Just nice casual beer. Hey, how's it going? We were joking around today, me and Brad Simons, that what we should do is have like a circle. Back all of our work trucks up in a circle. Everybody sits on their tailgate. That way you're far enough away, but you could bring your own beer, sit, social distancing, but have a circle of beers with the boys and you have a beer and away you go. Am I losing? I might have lost you.